World pandemics are global outbreaks of infectious diseases that affect a significant portion of the world's population, often with far-reaching social, economic, and health consequences. Here are some key historical world pandemics. Number 1 is Black Death from 1347 to 1351. The Black Death manifested in three main forms: bubonic, characterized by swollen lymph nodes; septicemic, involving the bloodstream; and pneumonic, affecting the respiratory system. The rapidity of its spread and high mortality rate led to profound societal changes, including labor shortages, increased wages for workers, and the rise of urban centers. Plague doctors were medical practitioners who specialized in treating victims of the bubonic plague during the Middle Ages and the Renaissance. These individuals played a critical role during plague outbreaks, even though their understanding of the disease was limited by the medical knowledge of the time. Plague doctors' costumes were distinctive and designed to protect them from infection during their work treating victims of the bubonic plague. These costumes are notable for their eerie appearance and have become iconic symbols of the historical fight against infectious diseases. Here's a detailed look at the components of their costumes. The most recognizable feature of the plague doctor's costume was the mask. It had a beak-like shape, often made of leather, and extended several inches in front of the face. The beak of the mask had two small openings for the eyes, covered with glass or crystal lenses. These lenses protected the eyes while allowing the doctor to see. Inside the beak, a cavity held a variety of aromatic substances, including herbs, spices, dried flowers, and other sweet-smelling materials. Second one is cholera pandemic from 1852 to 1860. This pandemic had a profound impact on public health practices, with the development of sewage and water treatment systems to prevent contamination. Third one is Spanish flu from 1918 to 1919. Despite being called the Spanish flu, its origin remains uncertain, with hypotheses suggesting it may have started in the United States or China. The virus had an unusually high mortality rate among young adults, which contributed to its devastating impact on the global population. The pandemic occurred during a time when global healthcare infrastructure was less advanced than today, making it challenging to control. Number 4 is HIV or AIDS pandemic 1981 present. The HIV or AIDS pandemic has led to extensive research into antiretroviral therapies, which have transformed HIV infection from a terminal illness to a manageable chronic condition. Significant efforts have been made to reduce HIV transmission through education, safe sex practices, and needle exchange programs. Fifth one is COVID-19 2019 present. The COVID-19 pandemic has accelerated the development and distribution of vaccines, with multiple effective vaccines authorized for emergency use. It has highlighted the importance of global collaboration in public health and the need for rapid vaccine production and distribution during pandemics.